Hi, my name is Caitlin Wood, and this is my presentation on narcolepsy. Here's my table of contents, which is everything I'm going to be going over in my slides. I'm first going to start with an overview of narcolepsy and then move on into the symptoms, how to diagnose, some treatment options, type 1 narcolepsy versus type 2, contributing factors, and the latest scientific updates. Narcolepsy is a chronic neurological disorder that affects the brain's ability to control sleep-wake cycles. People suffering from narcolepsy can get plenty of sleep, but feel tired throughout the day. Most people with narcolepsy have trouble falling asleep and staying asleep. They will experience fragmented sleep, which ultimately leads to an increasing feeling of tiredness. Narcolepsy affects 1 in every 2,000 people in the United States. In total, that's 200,000 Americans and roughly 3 million people worldwide. Narcolepsy affects more men than women, and it can be diagnosed anywhere from age 5 to 50. Narcolepsy diagnoses are most commonly made around the late teens and early 20s. Here are some common symptoms of narcolepsy. So first, people most commonly present with excessive daytime sleepiness, or EDS, which is constantly feeling tired throughout the day and needing to take naps to renew energy. Some people might only experience EDS every once in a while, like when they are especially lacking in sleep, and others might feel this every day and it won't go away even with plenty of sleep. Those presenting with EDS can experience sleep attacks throughout the day to combat tiredness. This is the sudden urge to fall asleep. Sleep paralysis is the temporary paralysis or the inability to move or speak while either falling asleep or waking up. Frightening and vivid hallucinations commonly accompany sleep paralysis. Some hallucinations can manifest themselves into sleep paralysis demons, which are dark, shadowy figures that seem to lurk around in the dark while a person is in paralysis. And another common symptom of narcolepsy is fragmented sleep, which is when a person will only sleep for short spurts at a time and be restless or wide awake for the rest of the time. The complement to fragmented sleep is insomnia, which is a sleep disorder where people have trouble falling asleep and staying asleep. Throughout the world, roughly 10% of adults struggle with insomnia to the point where it is diagnosed as a disorder, and about 30% of the adult population has dealt with insomnia at some point throughout their lives. REM sleep behavior disorder is where people will have physical reactions to vivid dreams or hallucinations. These reactions include kicking, screaming, shouting, and grabbing. Lastly, cataplexy is a brief episode of muscle weakness that is triggered by strong emotions of sadness, anger, and or excitement. The severity of cataplexy attacks differ from person to person. Cataplexy can oftentimes be confused with a seizure because the body will collapse and become limp. However, people remain conscious during cataplexy attacks, and they still have control over most of their body, unlike seizures. There are 2 specialized tests that diagnose narcolepsy and separate symptoms from insomnia or other similar sleep disorders. A polysomnogram is a test that records brain activity, muscle movements, and REM, rapid eye movements. Sleep studies usually take place during normal sleeping hours, so patients are not knocked off their sleep schedule. There are many sensors and monitors that are used during a sleep study, and some of these include electroencephalography, or an EEG, and this is where sensors are placed on the patient's head with conductive gel to monitor brainwaves. Electrocardiography, EKG or ECG, is where a single EKG sensor is placed on the patient's chest to monitor the electrical activity of the heart. A pulse oximeter is an adhesive sensor placed on the index finger that reads pulse and the level of oxygen in the blood. And a respiratory inductive plethysmography belt is a belt that's placed around the patient's torso, and it detects the expansion of the torso while the patient breathes. And then the multiple sleep latency test is a test used to measure daytime sleepiness. The procedure of the test is as follows. The patient will go to a sleep lab and lie in a bed with different monitors and sensors attached to them to monitor brainwaves and muscle activity, much like a polysomnogram. There are 5 20-minute sleep opportunities given to the patient. During each 20-minute nap, the patient will be instructed to fall asleep. If the patient takes a shorter time to fall asleep or an abnormally longer time to fall asleep, their sleep latency score will be reviewed and it will be determined if they have excessive daytime sleepiness or if they suffer from sleep attacks. From there, it can be concluded that the patient has narcolepsy or a similar sleep disorder. Two categories of treatments that have proven to be effective among narcolepsy patients are medications and lifestyle changes. Some medications that treat symptoms of narcolepsy include wake-promoting agents, antidepressants, and sodium oxybate. Wake-promoting agents, aka central nervous system stimulants, are less addictive and have fewer side effects than other stimulants. These are effective at reducing excessive daytime sleepiness and improving alertness. Antidepressants are able to control cataplexy in narcolepsy patients. Tricyclics and noradrenergic reuptake inhibitors are the two main classes of antidepressants that can treat narcolepsy. Tricyclics may include protriptyline, imipramine, and clomipramine, and noradrenergic reuptake inhibitors may include fluoxetine and venlafaxine. These antidepressants can suppress the REM cycle of sleep, which is where cataplexy usually occurs. And sodium oxybate is able to slow down brain activity, which treats cataplexy and narcolepsy. So some lifestyle changes to treat narcolepsy include taking short naps throughout the day, which helps renew energy and combat feelings of sleepiness. Avoiding caffeine several hours before bed ensures that the neurotransmitter adenosine is not blocked because it promotes sleepiness. And avoiding alcohol before bed will help sleep-wake cycles to not be interrupted, so that people with narcolepsy can have an easier time falling asleep and staying asleep. Lastly, exercising about 4 to 5 times a week and for at least 30 minutes can reduce excessive daytime sleepiness and tire the body out so that people are able to sleep more and stay asleep for longer. Narcolepsy patients can identify with having narcolepsy type 1 or type 2. Narcolepsy type 1 is narcolepsy with cataplexy, and it affects roughly 20% of cases. And narcolepsy type 2 is narcolepsy without cataplexy, and it affects roughly 80% of cases. People with narcolepsy type 1 have low levels of hypocretin, which is a natural chemical that helps people stay awake and controls REM sleep. People with narcolepsy type 2 exhibit normal hypocretin levels. People with either type of narcolepsy will almost always present with excessive daytime sleepiness. Narcolepsy is a chronic disorder that people can develop mainly through autoimmune disorders, family history, or brain injuries. Autoimmune disorders can confuse good cells in the body for bad cells and start killing off the good cells. When healthy cells are killed off in the brain, the levels of hypocretin are reduced. This can contribute to the development of narcolepsy because hypocretin is a neuropeptide that is produced in the hypothalamus and projects itself towards the parts of the brain involved in sleep-wake cycles. And then the majority of narcolepsy cases do not stem from family history and are not proven to be completely genetic. However, about 10% of type 1 narcolepsy patients are known to have a family history of the disorder. So the main cause of narcolepsy is unknown, but there are many environmental factors that can contribute to the development of the disorder. One being brain injuries. Any brain injury that damages parts of the brain that regulate wakefulness and REM sleep can be a contributing factor to narcolepsy. Lastly, there are many scientific updates in understanding the cause of narcolepsy, but here are a select few from the National Institute of Neurological Disorders and Stroke. Some narcolepsy patients can present with unusual immune system activities. Studies have shown that strep throat and certain varieties of influenza are contributing factors to narcolepsy. The real question that scientists are asking is, how can abnormalities in the immune system result in killing off cells with hypocretin? Scientists are trying to understand how much impact genes have on the development of narcolepsy. Now they are testing animal models to see how hypocretin and glutamate play a key role in regulating wakefulness and sleep. Hopefully there will be enough genetic testing and technological advances that can result in a long-lasting treatment for narcolepsy. And understanding the biology of sleep is going to be helpful in seeing how the brain functions in a patient with narcolepsy, as opposed to how a person's brain functions without narcolepsy. The biology of sleep is also a crucial part of being able to determine suitable treatments for narcolepsy patients.